Ebola dominates the health headlines. It has become the health emergency. Cone Health has been preparing. We'll show you what those preparations look like in this month's special edition of CodeVU. Should an Ebola case come to Cone Health, chances are it will come through an emergency department or an urgent care center.
My name is Terry. I'm one of the nurses. I'm going to be getting you ready to see the doctor this morning.
The main goal of Cone Health's Ebola plan is to identify, isolate, and call infection prevention. To do that, patients are being asked a specific set of questions developed by the Centers for Disease Control.
Have you traveled outside of the United States?
The questions are designed to help clinicians figure out those most likely to have Ebola. Once a potential patient is found, they'll get a mask and are isolated until the infection prevention team explores their case further. Caregivers will put on personal protective equipment if further patient care is needed.
We've isolated this part of the hospital, and specifically this unit, to be our designated treatment for a suspected Ebola patient.
This hallway on 2 Hart, formerly 2900, will be the cold zone with equipment and supplies. Caregivers will don personal protective equipment here. A small room at the end is the warm zone. A point of care lab will sit in this taped off area, and this is where clinicians will take off and throw away their personal protective equipment. The hot zone is the patient room.
We probably would have containers to dispose of any bodily liquids, and also just ensuring that we have the proper trash collection units. And then we would probably have some computers in here, and any equipment that we would use for the patient we would keep in this room and not necessarily take out and use them with any other patient.
Medications, food, and other items will be brought in by nurses. Only a handful of staff will actually come into the hot zone to provide direct care to the patient.
Seal and coverage right around the bridge of the nose.
Those caregivers and others most likely to provide care to Ebola patients are going through PPE training. They are practicing putting on and taking off PPEs. The idea is to avoid getting any bodily fluids from an infected patient on your hands or your skin, because that is how the disease is spread. Ebola doesn't spread through the air like the flu.
That you foam in between every single step.
Providers across Cone Health safely care for patients every day using PPEs. Think of this as a refresher course.
They are competent to use it all. What we want them to do is to feel more confident in using it. And so that's why we heard hands-on is what we need, and that's what we're providing.
One big difference from day-to-day work is that there is a checklist, and everyone will have someone watching them.
Because there's always a buddy there. So there's always someone looking out for you and your best interest. And so that was key in the training that we felt was important, that you never do this alone, so we can always care for each other and keep each other safe.
Who's on the line?
This is Ann at Wesley.
Cone Health began drawing up Ebola plans in July, but recommended equipment and safeguards have been evolving. Cone Health keeps up with the latest from the CDC and others in this command center. This group of Cone Health leaders meets 3 times a week to carry out Ebola plans and stay on top of the latest.
It's not that we're changing just to change. It is change because the best practice is being created as this occurs. So it's really creating the best practice.
This model is also being used here, right? We are doing mock PTU units.
Chances are you have questions about Ebola. If so, take them to regularly scheduled town halls where members of the infection prevention team and others have the latest information. Or you can check out Cone Connects. The yellow Ebola button takes you to a vast resource of the latest information about the disease. Very few people believe an Ebola patient will be diagnosed in our area, but everyone agrees that Cone Health must be, and is, ready in case that happens. I'm Doug Allred, and we'll see you next month.